All right, so we're going to survey all of our surgeons, maybe some of our nurses, on what they think about breast enhancement above or below the muscle.
Honestly, today, most patients are trending to go above the muscle. They want an easier recovery, and they want the implant to sit exactly where it's going to sit right away.
Below. Below, 100%. Above.
Depends. Depends on the anatomy, depends on the device, depends on the patient's goals, but we are doing more and more over the muscle.
I personally prefer subfascial based on a little more easier dissection. I think with the newer generation of implants, they really give a nice pop and really good form and good natural appearance.
There are cases where I like to go underneath the muscle. If the patient does not have a lot of soft tissue or their envelope is thin, what I mean by their breast tissue is thin, we have to go underneath the muscle. And because of that, does that mean the recovery is going to be that much more? No, it's just a little bit more painful, and the implant tends to stay a little higher for a little bit longer to get your final result.
All right, so then the next question, the lower lid and cheek, how to approach it, what does each surgeon or provider like to do?
My approach to doing surgery of the lower eyelid is actually make an incision underneath the eyelashes, remove the excess skin, remove the excess fat that's herniating, but that alone does not solve everything. A lot of times we end up having to tack the lower eyelid back up, and oftentimes because they're deficient of tissue in the cheek region, we end up adding more volume to that area. A lot of times for us, the best volume to add is fat.
The approach to the lower lid blepharoplasty is a transconjunctival approach.
I like to approach it in a multimodal fashion, meaning it's not just one thing. It's not just getting rid of the skin. It's not just getting rid of the fat. You actually have to get rid of the fat, get rid of the skin, and also add fat back to the lower lid cheek to improve that junction. So I actually like to do micro fat grafting, and then at the end do laser. So it's actually like a quadrupod of things that you have to do. 4 things in one procedure. Lower lid blepharoplasty with fat removals. You remove that skin also. You add fat back to the cheek, and then do laser the skin.